What percentage of the population has scoliosis? The Scoliosis Research Society has current estimate that close to 7 million people living with scoliosis are in the US alone. Now, scoliosis is the most common spinal condition among school-age children, and scoliosis unfortunately can affect all ages, but it's most commonly diagnosed or associated with adolescents. Now, the truth is 2 to 3% of the population are estimated to have scoliosis. And remember, these numbers include only the United States, and it's only in diagnosed cases. We honestly believe we don't catch all cases of scoliosis, and many cases go undiagnosed until they find out they have scoliosis later on in life because of some kind of pain or trauma or some kind of x-ray or imaging that may be performed from it because of another condition. And we know scoliosis accounts for about 20% of all American spinal conditions, so it's a significant number. When we look at scoliosis, there's approximately 600,000 yearly doctor visits that are accounted to scoliosis, and these are the ones that are said that scoliosis is the reason why they came in. Many patients go in for other conditions and they actually discover scoliosis, and these visits are not typically counted into this number. Approximately 30,000 children are fitted with scoliosis braces yearly, and there are approximately 132,000 yearly hospital visits and roughly about 17,000 emergency visits per year with children alone with scoliosis. Now, we know there's different types of scoliosis, and the most common type is something that we call idiopathic scoliosis, and this accounts for approximately 80% of known cases of scoliosis. The remaining 20% are associated with other known causes, and these are neuromuscular scoliosis, degenerative scoliosis, and congenital scoliosis. Now, idiopathic scoliosis means that there is an unknown cause. We don't know why the scoliosis is happening. These are considered particularly healthy, normal people, and for whatever reason, they're developing a scoliosis. We believe the causation associated is a multifactorial condition, meaning there's many variables and factors that can lead to a scoliosis developing, and these factors are considered unknown. So therefore, nobody can tell you what's causing your scoliosis if you have it. And the most prevalent type of this idiopathic scoliosis is typically diagnosed between the ages of 10 and 18 years of age. And this is why we say scoliosis typically is associated with adolescents, because it's the most commonly time when it's diagnosed, because this is a stage that unfortunately adolescent cases can progress. Now, unfortunately, the rate of adult scoliosis is also there as well. And even though scoliosis is more commonly diagnosed in children, the rate of scoliosis, meaning the percent of population of people with scoliosis, increases with age. And the reason why it increases is because it's due to all the patients that develop adult-onset scoliosis, even though we believe this is only 20 to 30% of all adult cases, but it's also all the adolescent cases that go undiagnosed, that go through the adolescent stage, never get diagnosed, and they get found later on in the adult form. So therefore, as we look at age groups, the percent of population that exists with patients with scoliosis increases. So we know there's been studies to show that anywhere between 12 and 20% of adult patients have some form of scoliosis. In fact, one study looking at adults over the age of 60 found rates as high as 68% of patients over the age of 60 potentially could have some type of scoliosis. So we know there's this kind of curve that occurs that as patients get older, the population of patients that exist gets greater. So we have more and more and more patients that are experiencing or developing scoliosis or being diagnosed with it. Now, scoliosis, unfortunately, is a progressive condition. It is its very nature to worsen over time. So a lot of adolescents may never be diagnosed because the curve is not small, not causing any problems or pain, but left untreated, it worsens in the adult form, and now they start having pain or discomfort or some kind of functional concern, and they find scoliosis. So therefore, since we know curves worsen and they cause problems as they get bigger, the best time to treat scoliosis is always when it's smaller, because a smaller curve is always easier to treat. In addition, we know growth in adolescent cases in that age group between 10 and 18 is when curves are most likely to progress rapidly. So scoliosis in any child that's pre-puberty should be taken seriously because it has the greatest risk to develop and progress during the adolescent stages. And this rapid phase of progression is unpredictable. We can't tell you which ones will worsen and which ones will not, and we can't tell you when they'll worsen, and we can't necessarily tell you how much they will worsen. So the best thing to do is to reduce reduce the risk of progression by reducing the curve. We do know as curves get bigger, they're more likely to progress, and as curves get bigger, they're more likely to cause more problems, and as curves get bigger, the treatment options become more invasive. So therefore, treating curves smaller definitely makes more sense. In addition, in the adult form, we know curves progress slowly in the adult form, and they accelerate as patients get older. Somewhere in this post 50 years of age or so, we tend to see an acceleration of the curve progression, and this is just gravity over time. So somewhere in this 58 years of age group or so, patients start to experience pain and discomfort. They go in for examinations. They're said they have scoliosis, and even though they may have never known they had scoliosis, and it was an adolescent case that was never diagnosed, and they're experiencing discomfort in the adult form. And even though it starts off slow, it accelerates as they get older, and this acceleration could be very difficult to manage in later stage life. So therefore, it's also true with adult cases to reduce the scoliosis earlier. Now, unfortunately, in both cases, adolescent and adult cases, mild curves are normally not treated. They're normally not treated proactively. They're said, just don't worry about it, watch and wait. And if it becomes more severe, we'll consider more invasive treatment. And the truth is, when scoliosis is treated proactively, it's much more treatable. It's much more ability to reduce the curve, reduce complications, reduce cosmetic impacts, and reduce the progression, and to reduce the need for very invasive surgical intervention in the future. So therefore, we know scoliosis is a highly prevalent condition in adolescents, in adult cases, and in later stage life. And even though there's never treatment guarantees, early diagnosis associated with early treatment definitely opens up much more a broad spectrum of improvement and preventing more future serious treatments than leaving it untreated and seeing what happens. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.